If you've ever been in therapy, you've probably noticed that the session ends at around the 50-minute mark, not a full 1 hour. Not 45 minutes, it's almost always 50. And once you start wondering why, it turns out the answer is a mix of history, practicality, and a bit of tradition that stuck around. The whole thing actually starts with Freud. In his 1913 paper on beginning the treatment, he described keeping very fixed session times. His sessions were usually around 55 minutes, with a short gap between the next person. It wasn't based on research or some discovery that 55 minutes was the perfect emotional window. It was simply a structure that allowed him to see multiple patients in a day while still having a few minutes to write notes and reset. As psychoanalysis spread, other clinicians copied the structure. Over time, the gap between sessions grew slightly, and the working session settled into about 50 minutes. It became a professional rhythm that everyone learned and passed on. This eventually became part of what psychoanalytic therapists call the frame. The frame is the consistent structure of therapy. Same time each week, same room, same boundaries, same session length. The idea was that predictability helps people feel safe enough to open up. So, even though the original reason was practical, the 50-minute session became symbolically important. It was part of the container that held the work. The remaining 10 minutes in the hour aren't downtime. Therapists use that gap to write clinical notes, which they're legally required to keep, document any risk concerns, plan the next session, and mentally reset before seeing the next person. Therapy is emotionally intense, and carrying one client's story straight into the next session isn't good practice. That buffer protects both the therapist and the quality of the work. Then there's the modern influence. Let's talk about insurance billing. In the United States, the standard code for individual therapy, CPT 90834, covers sessions lasting 38 to 52 minutes. A 50-minute session fits neatly inside that range. If a therapist goes past 53 minutes, they enter a different billing code. And insurers vary widely in how they reimburse it. Because of that inconsistency, most clinicians stick to the 50-minute model. Training programs teach it, clinics schedule it, clients expect it, and insurance reimburses it. So the historical habit became a system-wide standard. People often ask whether therapy could be shorter, like, for example, 30 minutes. And the answer is yes, but only for certain types of work. Shorter sessions can work well for structured, skills-based interventions like guided self-help, behavioral activation, psychoeducation, or low-intensity CBT. These formats are more focused and don't require as much emotional warm-up. But for most therapies, trauma work, EMDR, psychodynamic therapy, attachment-based work, or CBT for more severe presentations, 30 minutes is usually too short. Research on psychotherapy process shows that meaningful therapeutic depth tends to emerge after the first 15 to 20 minutes. A 30-minute session often ends just as the client is settling in. On the other end of the spectrum, people sometimes wonder why therapy isn't longer, like 90 minutes or more. Longer sessions do exist, but they're usually used for specific reasons. EMDR often uses 90-minute sessions because the processing phases take time. Couples therapy frequently runs 75 to 90-minute sessions. Intensive trauma therapy sometimes uses half-day formats. And some private therapists offer extended sessions for clients who travel long distances. But longer sessions aren't the default because they create practical issues. Therapist fatigue, scheduling difficulties, reduced capacity to see multiple clients, emotional overwhelm for clients, and insurance complications. There's also research showing that session frequency tends to matter more than session length. Regular weekly sessions often outperform occasional longer ones because of consistency and momentum. Interestingly, there's no research showing that 50 minutes is the best length for therapy. What research does show is that consistency matters more than duration. The therapeutic relationship predicts outcome far more strongly than time spent. And different modalities have different needs. The 50-minute session isn't evidence-based in the sense of optimal. It's evidence-compatible, meaning it works well enough for most therapies, most clients, and most schedules. So when your therapist wraps up at minute 50, it's not arbitrary. It's a structure shaped by more than a century of practice, reinforced by modern systems, and supported by what we know about how therapy actually works. It's a balance between history, practicality, and the realities of doing emotionally demanding work day after day. If you've enjoyed this video or found it useful, don't forget to like, share, and subscribe to the channel to get more videos like this one.